Disclaimer: please consult your physician for personalized medical advice. Always seek the advice of a physician or other qualified healthcare provider with any questions regarding a medical condition. Never disregard or delay seeking professional medical advice or treatment because of something you have heard online. Do you know what the hardest part of breastfeeding is for most women? It is learning to effectively latch. Learning how to breastfeed is a new skill for mom and baby to learn. It's typical to feel some breast pain and soreness as you and your baby learn how to breastfeed and establish your nursing relationship. Learning how to latch correctly should help to ease some of the soreness you may feel while allowing baby to enjoy a full feeding. Here are some tips for establishing a good latch for you and your baby. 1. Get in the right position. Proper positioning is key when trying to get a good latch while breastfeeding. Don't hunch your shoulders and push your breast into your baby's mouth. Try bringing baby's mouth to your breast instead. There are several different breastfeeding positions you can try, so it's best to experiment to see what works best for you. The cross-cradle or cradle positions are great positions to start with. As you become more comfortable, side laying and laying back positions are great to try, too. It's important for you to be comfortable. Breastfeeding should not hurt. It's best to find the right position where you're not tense, your muscles are not straining to hold yourself or your baby, and your breasts and nipples aren't being excessively pulled, which may cause a lot of pain. If your baby's latch does not seem correct or you are experiencing any prolonged pain, feel free to unlatch baby by placing a clean finger in the corner of your baby's mouth to release the seal of the latch and try again. If you have to do this more than twice, try changing your position to find something else that might work better. 2. Keep practicing. It's true what they say, practice makes perfect. In the early days immediately following the birth of your baby, it is best to feed readily and often. Babies are known to cluster feed, especially in the late afternoons and early evenings. Cluster feeding is a time when your baby wants to enjoy short feeds over a span of a few hours. During this time it may seem like baby wants to eat all the time around the clock. Remember, this is normal for a baby and often happens in the early days of breastfeeding. The more you practice breastfeeding during these times, the more experience you and your baby will have and the better your baby's latch will become. 3. Don't be afraid to ask for help. The early days of breastfeeding can seem very difficult, but oftentimes the initial struggles you will face will fall away as you practice your latch and get more accustomed to breastfeeding your baby. If you're still having trouble after a few breastfeeding attempts, consider hiring or contacting a lactation consultant, who can go over the basics of breastfeeding with you and help you overcome any latching setbacks. Other breastfeeding support groups like Latch League and those found in hospitals and birthing centers are oftentimes eager to help. Many of these support services are free or are covered by health insurance. Maintaining a good latch is key in easing breastfeeding discomforts such as sore, cracked, and irritated nipples and establishing a positive breastfeeding relationship. When a good latch is maintained, it also lessens the risk of breastfeeding complications such as engorgement and mastitis. Once your baby is able to latch and suckle properly, a good milk flow will be available and baby can effectively empty your breast. This will help your baby in feeling full and comfortable and getting enough milk for proper nutrition, hydration, weight gain, and development. Please click the subscribe button to stay up to date with the latest breastfeeding tips and information.